the nutritional channel of life-prolonging percutaneous endoscopic gastrostomy PEG.
Doctor, my wife accidentally burned her esophagus. There is no way to eat now, but you can't rely on nutrient solution all the time. Is there any way I can help him?
Some burn patients don't have a temporary nutritional problem. I recommend enteral nutrition. Enteral nutrition is a method of oral or tube feeding through the gastrointestinal tract. Provide the body with the nutrient matrix and other nutrients required for metabolism. It includes nasal feeding and percutaneous endoscopic gastrostomy. In your case, percutaneous endoscopic gastrostomy PEG is recommended. During surgery, the doctor places a local anesthetic in the abdomen. Then a puncture needle is pierced through the abdominal wall into the stomach. A guided fistula was placed under the guidance of a gas. The resulting nutrient pathway is formed. Percutaneous endoscopic gastrostomy PEG is suitable for the following people: patients with mechanical throat and esophageal stenosis, such as tumor obstruction and compression, especially high esophageal obstruction. Second, patients who are in a long-term coma and cannot eat on their own, such as stroke and motor neurological diseases. 3. Patients who require long-term indwelling of a gastric tube for various reasons. 4. Patients who require gastrointestinal nutritional support, such as esophageal perforation, esophagotracheal, fistula, esophageal cancer, anastomotic leakage, and some patients before and after surgery nutrition support and chemotherapy. Patients with esophageal stricture due to physical and chemical factors, such as severe reflux esophagitis and chemical esophageal burns. Patients with difficulty chewing and swallowing due to muscle movement disorders, such as the throat and esophagus, caused by various neurological diseases, such as polymyositis, sclerosing muscle atrophy, and so on. 7. Genetic diseases. If you have oculopharyngeal muscular dystrophy, PEG can help them consume water and food, maintain body metabolism, weight, and nutrition.
Percutaneous endoscopic gastrostomy, PG, brings many conveniences and benefits. For doctors, PEG is easy to operate and quick for patients. Quick postoperative recovery, and avoids open intubation surgery compared to nasogastric. The fistula tube PEG also has the following advantages. Firstly, it can inject more kinds of food and more balanced. Second, it lasts long and does not need frequent replacement. Third, the fistula tube can be hidden while improving the quality of life without affecting beauty, with fewer complications. PLIG. Daily care steps. 1. First, before feeding care, wash your hands and clean the food utensils and syringe to avoid infection. Second, every morning when you wake up, use 100 to 200 milliliters of warm water to flush the tube. Third, before eating, withdraw gastric fluid to observe the residue. Fourthly, then inject 30 milliliters of warm water with syringe to flush the PEG tube. Note that the water temperature, which can burn the gastric mucosa, the temperature should be around 35 to 55. Fifth, use a grinder to mash the food, and then connect the gastric tube connector. After connecting firmly, inject water and food into stomach. Eat every 2-3 hours a day, for about 20 minutes each. Each intake should not exceed 50 milliliters. Sixth, after eating, you also need to use a syringe to inject 50 milliliter to flush the pipe. Finally, before going to bed, use 20 to 30 milliliters of soda water or sugar-free carbonated drinks to the PEG tube and stay for 10 minutes, and then flush the pipeline with 100 ml of warm water. For pipeline care, when using it, you also need to pay attention to the following. Try to use fresh food, and water should be prepared to avoid food spoilage, especially in hot weather. In terms of eating, you should sit or lie on your side when eating. Never lie flat on your back. After eating, keep the upper body upright for 30 to 60 minutes. To facilitate the emptying of food, to prevent risks such as poor injection, reflux, vomiting. In terms of the fistula and tube, pay attention to use a cotton swab dipped in saline to clean the skin around the stoma and the silicone part of the tube. The used PEG tube, it needs to be wiped again with warm water to avoid accelerating aging. In case the fistula tube is accidentally pulled out, be sure to keep the PEG fistula tube. Go to the nearby digestive endoscopy center at once. Try to reinsert it within 24 hours. In general, PEG is a safe and effective, simple and convenient way of nutrition delivery, but also a nutritional channel for life.